In this lecture, we are going to discuss the bone healing. Bone healing process in the pediatric bone starts immediately after the fracture. How this process starts, what is the first step in the healing process is inflammation. What happened in is hematoma formation and the fibrin formation, which lays down the framework for the bone formation. What is the next step? The next step is the reparative phase, the formation of primary callus and hard callus, and there's a lot more bone is formed, and there's a quality bone. Quantity is more, but the quality is the soft bone is not. A lot of bone is formed. And what is the next step? Next step is a remodeling phase. And remodeling, look into the details of the remodeling process. There's a lot of quality bone formation, and the more and more bone is along the stress lines, and then it is converted into the normal bone. What happens in the healing process? What happens in the healing process? What is important from where the healing starts? We need an endosteum, which is the inner side of the bone, and the periosteum, which is outside covering of the bone, pediatric bone. These are the two big sources for the stem cells, which ultimately leads to the start of the healing process. There are types of healing. There are two types of main healing. Bone healing is a primary and a secondary healing. In the primary healing, there is always a fixation of the bone. There is no micromotion, and there is a predominantly intramembranous ossification, like in the plate fixation. And on the other side, there's a lot more callus formation. There's no fixation, and there's intracartilaginous ossification. And this figure shows the different stages of healing. That is basically an inflammatory phase, 0 to 1, and then it's a 0 to 5 days, and 5 days to 10 days, and 7 to 21 days, and it's all the different processes of intracartilaginous or intramembranous ossifications, how the chondrocytes they are formed, and they're hypermature, and these are ossified. Now comes the factors of which are affecting the bone healing. The systemic factors, the age. The children heal more quickly than adults. There's high healing potential, remodeling potential, and it decreases with the increasing age. Nutrition is important. Poor nutrition and the vitamin D deficiency that affects the healing process. General health, if the patient is having chronic illnesses, then there is a delayed healing. Generalized atherosclerosis, blood supply to the healing has decreased healing because of the blood supply. Hormone factors enhance the healing. Corticosteroid depresses the healing. The drugs, non-steroidal inflammatory drugs, they also depresses the healing. Smoking also decreases the healing process. There are some local factors. The degree of bone trauma, bone loss. If the comminuted fracture, most of the injury is slower to heal. The area of bone affected, if metaphyseal fractures heal faster than diaphyseal, because there's a lot more blood flow to the metaphyseal area, and there's also a good remodeling potential of the metaphyseal as compared to the diaphyseal area. Abnormal bone, if there is an infection or tumor, or if the bone is already treated with the radiations, they are usually slower to heal. The degree of immobilization of the fracture, the motion of the fracture site delays the healing. And if there is disruption of the vascularity, there also delays the healing. If there is stripping of the periosteum, stripping of the muscle from the bone, there is delays the healing. In summary, the remodeling potential of immature bone compensates for any of the deformity. More remodeling, 75%, occurs at the epiphysis. So more remodeling, 75%, is in physis, and less remodeling is in the metaphyseal and diaphyseal regions. And understanding the facts in healing guide for the treatment of pediatric bone fractures, and this all difference is because of the blood supply of different areas in the physis, metaphyseal and diaphyseal has very less remodeling potential.